Lack of access to oral health care worldwide and the health impacts. So a little bit about me first. Hi, my name is Isha Kothakunda, and I'm a rising senior from West Windsor, New Jersey. This is my first year, so I'm beyond excited to meet equally curious and passionate people like me. I have a passion for science, medicine, and dentistry. My extracurriculars align with my ambitions to pursue dentistry and medicine through volunteering, research, internships, club, and passion projects. I'm the host and captain of knowledge at High School South, placing in regionals and states, and future president and currently secretary administration for High Schools North UNICEF. Moreover, I'm a high school rover, a dancer, a part of the Junior State of America, and published artist. I was a part of the Community Learning Service Program at the Kinder Smile Foundation in the Kinder Smile Community Oral Health Center in Trenton, where I volunteered to complete the mission to help teach families about oral hygiene. I gained more awareness and knowledge of the lack of access to oral health among at-risk adolescents and families, the impact on their overall health, which started my passion for this topic and furthered my interest in global health. So for some background, oral diseases affect 3.5 billion people worldwide and are one of the most widespread diseases globally. Although oral diseases are mainly preventable, they act as a health burden in many countries and influence people throughout their lifetime and lifestyle. The ramifications of chronic untreated oral diseases can range from inflicting pain, sepsis, lost school days, disruption to family life, decreased work productivity, and even death. Though this is a transparent global issue, many lack the awareness of how severe this matter contributes to the overall health and economic burdens. This matter portrays the universal social economic inequalities and insufficient funding for treatment and prevention. This affects many low-income, middle-income countries just as much as well-established countries. It targets socially marginalized groups, children living in poverty, and other older people, as they are most affected by oral diseases and have deficient access to oral care. The treatment set large financial and economic trouble for families and healthcare systems. Inadequate access for appropriate health facilities to meet population needs in most countries. Through public health interference and addressing common risk factors, oral diseases and alternative non-communicable diseases can be decreased. Oral diseases are assuredly a global public health problem that is often neglected. And some of the most common diseases are listed. Periodontal diseases affect the tissue that both surrounds the tooth and that surrounds the jaw. This disease is characterized by bleeding or swollen gums. Oral cancer includes cancers of the lips, part of the mouth, and oropharynx. The global incidence of cancer lip and oral cavity is estimated 4 cases per 100,000 people. Orodental trauma results from injury to the tooth, mouth, and oral cavity. Around 20% of people suffer from trauma to the teeth and at some point in their life. Noma is a severe disease of the mouth and face. It mostly affects children ages from 2 to 6, suffering from malnutrition, affected by an infectious disease, living in extreme poverty with poor oral hygiene, or with a weakened immune system. Factors that result from poor oral health care and hygiene. As you can see, these can affect many of the lifestyles that I have listed below, and these are the main causes and results from poor oral hygiene that many people face around the world. So for oral health care systems and diseases worldwide, the risk factors. Most oral diseases and conditions share a changeable risk factors such as tobacco use, alcohol consumption, basic oral hygiene, limited availability and accessibility of oral health care services, and an unhealthy diet high in free sugars, all of which increasing at the global level, and that are common to the 4 leading non-communicable diseases such as cardiovascular disease, cancer, chronic respiratory disease, and diabetes. Next, the lack of access. Oral diseases affect the poor and socially disadvantaged members of society. There is a very strong and consistent association between socioeconomic status, which is income, occupation, and education level, and the prevalence and severity of oral diseases. This association exists from early childhood to an older age and across populations in high, middle, and low-income countries, meaning that access to primary oral health care services is often low. Paying for necessary oral health care is among the leading reasons for health expenditures, resulting in an increased risk of impoverishment and economic hardship. Next, prevention. The burden of oral diseases and other non-communicable diseases can be public health intervention. Common preventions include factors such as brushing, flossing, fluoride rinse, healthy nutrition, reduction in sugar consumption, no tobacco use, and limiting the consumption of alcohol. In addition, promoting a well-balanced diet low in free sugars and high in fruit and vegetables, and favoring water as the main drink, and encouraging the use of protective equipment to reduce the risk of facial injuries. Actions that have already been taken. The Lancet Commission on Oral Health contributes in recommendations in including diverse voices and engaging communities, placing equity and social justice at the core, tackling major risk factors such as sugar intake, and embracing the topic and getting awareness. The World Health Assembly approved a resolution on oral health in 2021 at the 74th Health Assembly. The resolution recommends a change from traditional curative approach to preventative approach, such as promotion of oral health within the family, schools, workplaces that includes timely inclusive care within the primary healthcare system, and included within the non-communicable disease agenda and the oral health care intervention. In addition, the World Health Assembly does organization WHO to develop a draft global strategy on tackling oral diseases. So the conclusion, concept, and takeaway. Dental health is in fact an integral part of our overall health. This topic is important because it does not always receive the right attention that it deserves. The awareness surrounding negative oral health effects will open the many eyes of people who fall under this impression, and open the eyes to the consequences many people around the world face due to the lack of proper oral health care. Always keep in mind that prevention is considered a key in maintaining good overall health. The burden of oral diseases and other non-communicable diseases can be reduced through public health interventions by addressing common factors. Moreover, just the lack of access to just a crucial field among children's disparities in race and income affect many oral health indicators. Through my time in the Community Learning Service Program, I helped underserved children access to comprehensive dental care and education. Through this program, I contributed through education, prevention, and intervention as methods to combat dental diseases and empower children and their caregivers with knowledge about oral hygiene and its relevance to total health and wellness. The CDC states that health equity is attained when everyone has the opportunity to reach full health potential without the disadvantage of social or economic circumstances. Therefore, I hope to continue this goal and share the importance of the effects regarding the lack of oral health care that many people don't have around the world. An overall message that goes beyond oral health care that is vital is, as global health transcends national borders, it focuses on research, where the information and knowledge can make us aware of many negative situations, and the toll on us affects us globally. The following actions to utilize the evidence and knowledge to promote methods for health and improvement make us educated and spread awareness. And in addition, these are my references that I've used. These are my acknowledgements. So I want to thank you to the Global Health Leaders Conference at Johns Hopkins University team for allowing me to share a topic I am passionate on and for this opportunity. Thank you for the Kinder Smile Oral Health Foundation and the Oral Health Center for allowing me to be a part of the community service program that helped me boost this passion. And thank you to my family for always supporting me. And my contact is there. If any of you have any questions, please feel free to contact me.